Good evening once again. Welcome to my YouTube channel, and today we'll be talking about CSF proteins. In our previous videos, we talked about urine proteins and how proteins can find its way in the urine. We talked about how urine proteins can be diagnosed clinically. Today we'll be talking about cerebrospinal fluid proteins and how proteins are able to cross the blood-brain barrier and then enter into the transcellular compartment and become part of the cerebrospinal fluid. So let's start. So what you see right now is the structure of it's an illustration of the brain and the central nervous system, the brain and then the spinal cord, and then the blood-brain barrier as well. So you can see from the diagram that this is our brain, and then this is our blood-brain barrier. Then we have our cerebrospinal fluid in the spinal cord. Then we have the transcellular compartment. So in the body fluid compartment, we have we have the intracellular, and then we have extracellular. Now we are about to focus much more on the extracellular. So in the extracellular compartment, we have the interstitial space. That's the spaces that are found within that separate cells. Then we have the plasma or the vascular compartment. Then finally we have the transcellular compartment. It is within the transcellular compartment that we find the cerebrospinal fluid. So CSF is found in the transcellular compartment. So this is the transcellular compartment. Then we have our brain. Then we have our blood-brain barrier. Now, the central nervous system is highly selective in terms of the things it allows in and then out, and that selectivity is ensured by the blood-brain barrier. So the blood-brain barrier actually is a bunch of fitted epithelial cells that prevents substances from moving from the vascular compartment to the transcellular compartment. So it's like a barrier, and it's highly selective. It doesn't allow all substances, or it doesn't allow most substances, especially proteins and other large molecules, to enter into the transcellular compartment, which is why it's inappropriate for us to see proteins like albumin in the vascular compartment or in the cerebrospinal fluid. Okay. So now let's talk about some factors that affect the transfer of substances across the blood-brain barrier. So right now let's talk about lipid solubility. So the blood-brain barrier is lipid soluble. Therefore, it allows access of substances that are lipid soluble. It's lipid permeable, therefore allows substances that are lipid soluble. So for instance, when we talk about, let's say, bilirubin for instance, bilirubin is lipid soluble, and therefore is able to cross the blood-brain barrier easily. So in a disease condition like hemolytic disease of the newborn, whereby there is high amount of bilirubin in the body of the child affected with the condition, the unconjugated bilirubin will be able to cross the blood-brain barrier and then cause a condition we call kinectorus. So because the unconjugated bilirubin is lipid soluble, which is why it's readily or it easily have access to the blood-brain barrier to cause neurotoxicity. So once you cross the blood-brain barrier, you get access to the central nervous system. All right. Then we can talk about molecular size. Molecular size. So normally, the blood-brain barrier allows substances that are, let's say, 400 to 500 Daltons. And then proteins such as, let's say, albumin has 7,000 Dalton. So imagine how huge this molecule is. There is no way protein like albumin, or let's say 69 kilodaltons, will be able to kilodaltons will be able to penetrate through the blood-brain barrier because it's too huge. Then we can talk about molecules with specific receptors. So there are certain molecules that have specific receptors on the surface of the blood-brain barrier, and therefore allows the transport of substance in and out of the two different compartments. That's the transcellular compartment and the vascular compartment. So the size of the molecule too can also be a factor. Then we can talk about the charge and polarity. So charge and polarity. Alright. So these are the factors that affect the transfer of substances across the blood-brain barrier. Now let's talk about the characteristics of the cerebrospinal fluid. So first of all, we have to know how we can get the cerebrospinal fluid. So it's gotten through a procedure we call lumbar puncture. And then the lumbar puncture is done between the third and the fourth lumbar vertebra. Between the third and then the fourth lumbar vertebra. So we will penetrate a needle at an angle of 90 degrees between the third and then the fourth lumbar vertebra. Then we extract the cerebrospinal fluid. Now, before this one is done, we have to check the intracranial pressure before we take the fluid. So this intracranial pressure is checked first before we take the fluid from the spinal cord. So first of all, the appearance of the CSF must be clear. So characteristics. So appearance, CSF must be clear, must always be clear. So CSF is actually colorless and it's always clear. That is the general appearance we have for CF. But then there can be some abnormal appearance, such as the xanthrochromic. This is yellowing, discoloration. Of the supernatant. And this can be as a result of high bilirubin levels. As I said earlier on, bilirubin is lipid soluble, and then as a result it readily crosses the blood-brain barrier. The presence of proteins too Then we have proteins as well. So this one too can cause a change in the color of the cerebrospinal fluid. Then we can also have milky. So we may have milky CSFs. This one too may indicate increased lipids. Then we might see clots. So clots, which indicates increased what? Increased fibrinogen. Increased fibrinogen means there's a damage towards the blood-brain barrier. So damage to the blood-brain barrier. Now, I didn't talk about the intracranial pressure. So this intracranial pressure is like the pressure the cerebrospinal fluid exerts on the brain and then the brain tissue. The pressure the cerebrospinal fluid exerts on the brain and then the brain tissue. So if the intracranial pressure is high and then you take the cerebrospinal fluid, what will happen is that there would be a drop, an immediate drop of the intracranial pressure, and this can cause a condition we call brain herniation. And this brain herniation is the displacement of the brain tissue. So once the intracranial pressure drops, there would be a displacement in the brain tissue, and this is what we call a downward displacement of the brain tissue, and this is what we call the brain herniation. And this can even lead to death or a very serious neurological condition such as brain death or comatose state. So it is very, very essential to check the intracranial pressure before taking the CSF. There are diverse ways of checking the intracranial pressure. We have the invasive technique, and then we have the evasive technique. Invasive, and then let's say the external technique. So the invasive technique, for instance, they drill a hole in the skull and then they insert an instrument. And then for the invasive techniques, they can use MRI to measure the intracranial pressure. Alright. So that is just by the way, we are not doing anatomy or physiology here. This is just to understand the importance of the intracranial pressure. In future videos, when we talk about the brain, we will discuss much more into details. Now let's talk about the function of the cerebrospinal fluid. So the first function we can talk about is supplication of nutrients to the brain tissues. Then removal of metabolic waste substance. Protection and cushioning of brain tissues against trauma. So I think this will be the three main functions of the CSF that we should know. Okay. Now let's talk about proteins in CSF. So it's abnormal for us to see protein in CSF, and there's a whole range of implication that results the presence of CSF in proteins in what in CSF. So as we said earlier on, mostly the largest we know that the largest quantity of proteins that we have in the vascular compartment is albumin. Albumin. So albumin covers about 60%, 60 to 70% of the entire hot plasma proteins, right? Good. And albumin has a molecular weight from our previous video. Realize that albumin has a molecular weight of 69 hot kilodalton, which is way too huge, about 6,900 daltons. But we said earlier on that the blood-brain barrier allows the allows substances that ranges from 400 to what 500 what daltons. So if this large molecule is able to break or breach the blood-brain barrier, it means there is something wrong. It means the blood-brain barrier has been compromised, and that is an indication worth what investigating. So that is why proteins are not supposed to be found what in the blood-brain barrier. Now, just like every parameter, we have a normal range in which we can measure proteins in the CSF. So we have about 15 to 45 milligram per deciliter. So that is the normal range of what of protein that is supposed to be found in the blood-brain barrier. Now, if we have an elevated form of this, then we can suggest indications such as a damage. So a damage to the blood-brain barrier. Then we can say production of immunoglobulins within the CSF. We know that immunoglobulins are also known as the gamma proteins. They are also proteins. So if there is overproduction of immunoglobulins within the CSF, we can say that there is going to be a high measurement of proteins. Then degeneration of neural tissues. Okay. So this is the three main reason why we will get an elevated protein in the cerebrospinal fluid, and all these points are worth investigating. There is a damage to the blood-brain barrier. It's worth investigation. That damage could be as a result of brain trauma or something. Production of immunoglobulin within the CSF. It means there's an infection, a brain infection or something, because we know these immunoglobulins respond to infection. Then degeneration of neural tissue. Yes. So this one too can be as a result of, let's say, stroke or something. So anything neurological is worth investigating when we find large amount of protein being seen, or large amount of protein in the CSF. Now let's see how we are going to diagnose CSF in the laboratory. So laboratory diagnosis of CSF. So normally when we take cerebrospinal fluid in the laboratory, we place it in three tubes. So aside we measuring the protein content in the laboratory, the other investigation that also uses the CSF. So tube 1, tube 2. So this is the protocol. Tube 3. So for the tube 1, for instance, we have chemistries, and serology. So this is where we are going to measure our protein content. Then we have we have bacterial culture. Then tube 3 we have hematology. So normally tube 1 is frozen, tube 2 is stored at room temperature, and then tube 3 is refrigerated. And tube 3 is refrigerated. So we should take notice of this one. So these 3 tubes are very necessary in the clinical laboratory setting. Now let's talk about how we are going to get a laboratory diagnosis of cerebrospinal fluid. So the cerebrospinal fluid is best measured using a dye binding method. So dye binding method. In order to measure using spectrophotometry. So there is a procedure we call the commassive brilliant blue procedure in this case. So it's also a binding method, a dye binding method called the commassive brilliant blue procedure. And this binding method, just like other spectrophotometry method, when the dye binds to the protein component of the CSF, there's going to be a formation of a complex, and that complex will generate a color, and this color comparatively corresponds to a specific concentration, and that concentration will give you the concentration of the protein content within the plasma. So just like other spectrophotometry method. So this method is also one method that we can measure CSF proteins. So that will be it for CSF proteins. So let's do a very quick recap of what we've done so far. So first of all, we talked about the anatomy of the CSF proteins. We discussed the brain. We talked about the blood-brain barrier. We talked about the various body fluid compartments. Then we said that the blood-brain barrier prevents substances from entering the transvascular compartment. So it's a bunch of fitted epithelial cells. Then we said there are some factors that allow the transfer of substance across the blood-brain barrier. We said lipid solubility, molecular size, and the molecules with specific receptor and charge and polarity. Then we talked about the characteristics of the blood of the cerebrospinal fluid. We said we extract the cerebrospinal fluid using a procedure we call lumbar puncture, and we take it from between the third and the fourth lumbar vertebra. And we said before we take the pressure, we have to check the intracranial pressure first. If we don't check, if there's high intracranial pressure, it can lead to a condition we call the brain herniation. And that is the downward displacement of the brain tissues. Because once the pressure is high, the moment you take the cerebrospinal fluid, there's going to be a drop in the intracranial pressure, and that is going to displace the brain tissues. Then the CSF is generally clear. Then we have other abnormal coloration like the xanthochromic color, yellowing color. That could be as a result of high bilirubin levels and proteins. Then we have milky CSF, which indicates high protein levels. Then we have clots, which indicate increased fibrinogen as a result of damage to the blood-brain barrier. Then we talked about functions of the CSF, application of nutrients, removal of metabolic waste substance, and protection of and cushioning of brain tissues from trauma. Then we talked about proteins within the CSF. We said normally the CSF does not allow the entry of large molecular substances like albumin or like most proteins. If we find proteins, it indicates what damage to the blood-brain barrier or production of immunoglobulins within the cerebrospinal fluid or degeneration of what neural tissues. Then we talked about the laboratory diagnosis of what CSF protein. We said in the laboratory, once we extract the CSF, we put it in three main tubes: chemistry, bacterial culture, and then hematology. So this is the routine. And we said for the chemistry, we freeze. For the bacterial culture, it's stored at room temperature, and for the hematology, it is refrigerated. And we said that in the chemistry aspect, there's a way we measure the protein content, and it's by spectrophotometry or a dye binding method, which will be measured using spectrophotometry, and this is called the comassive brilliance blue technique. So this is a combination of a dye and then the analyte, and here the analyte is protein within the cerebrospinal fluid, and this leads to the formation of complex, and that complex is measured using spectrophotometry, and the absorbance of that complex is compared to a standard measure that indicates the specific concentration of the protein content within the cerebrospinal fluid. So that will be it for CSF protein. Thank you for listening. See you in future videos. Bye.